basic principles of fluid therapy in sheep and goat. We are going to discuss about some of the special consideration of the fluid therapy. Suppose the animal is hypothermic, you have to give a warm fluids. You have to fluids to be warm, like just to keep it in a water bath, and for after some time you just check it with your back side of your hand palm, and the fluid is not that much hot. You can give. That's actually below the anticipated body temperature, normal body temperature of the particular species of animals. You have to heat and give more heat with the teenager the bed. So that to be avoided. The next one, another thing is hypothermia. You can also go for some management aspect like warm water bottles. You can keep it near the gun. You can put the lightings, incandescent bulbs near to the animals to have a more heat. Then you have to expose the sunlight for a short period of time. Then hyperthermia is there. Heat stress. You have to use the cooling the fluids, and you want to give through the IV, and you have to sprinkle. How to cool? You have to keep it in a fridge, and after sometimes you check it. The temperature is not too chill, and it should be 5 degree or 6 to 10 degree below the anticipated normal temperature level. You have to give. So that is called as core cooling of the hypothermic or heat stress animals. Then you can also sprinkle lukewarm water over the animal and put a fan by the way of evaporation that will be having better normal temperatures brought from the hypothermia. In case of anemic animals and hypoproteic animals, protein is low, you have to select the fluids very judicially and don't go for overloading of the system. Judicial use of whether it's needed use or else less quantity of fluids, that to hypertonic solutions can be administered. In cases of any PPR, other mnemonic signs, PPR may also have a pneumoenteritis. So we need to give fluids. In case of PPR, the pneumoenteritis, the enteritis having a lot of dehydration. We need to select the fluid ringus lactate to replace the metabolic acidosis. And in case of pneumonia, you have to select the fluid appropriately, and dose also be very minimal. But strictly speaking, without any dehydration in pneumonia cases, don't give any fluid therapy. That is contraindicated. Pneumonia alone is there. How to identify the pneumonia? You have to go for auscultation. Animal have extended head and neck and having a breathing difficulty. So you can identify very well, and sometimes oral breathing also. And you auscultate the both side trachea and both side of the lung field. You can get a crackles and wheezes. So those conditions, don't give fluid therapy. If you are keeping the animal rat recommends, especially young kids, lambs, if you are giving a very little quantity of fluid, you will lose that animal because of pulmonary edema will develop. And some severe cases of dehydration along with the pneumonia is there, and the mucus secretions to be stimulated. For those conditions, minimal fluid therapy in case of any severe dehydration with pneumonia can be given. Along with fluid therapy, we need to give some diuretic also to avoid pulmonary edema. So for diluting any drugs, what type of fluids you can use? Normal saline, DNS, or D5. Here the D5, if you are giving only 5% of dextrose is utilized for the energy, remaining things is volume makeup only. It is not going to make up any electrolyte balance. Suppose normal saline and DNS, that is going to give some electrolytes because the no sodium is to be needed for the volume needs. Okay. And in case of ringus lactate, don't mix any drugs, especially the oxytetracycline and sodium background solutions. So that will have a precipitation, and sometimes you can also appreciate the clear precipitation. You can very well appreciate and leave. Or else sometimes it have a chelation. The calcium present in the ringus lactate may be chelating the oxytetracycline. Sometimes that may not be useful. Even after the therapy, you are not going to achieve your success in the treatment of any blood pressure disease. Okay, mainly avoid any drugs to be added into the ringus lactate. And some of the things are sodium containing fluids. That is actually, there is a two compartments of the circuit problem, and in case of any shock, there is a circuit problem. Circuit problem is peripheral circulatory failure. Another one is pump problem. That means heart is not going to pump. That is a pump problem. Suppose the sodium containing fluids, especially in hypovolemia, more useful for the circuit problems rather than the pump problems. The pump problem is congestive heart failure. The sodium containing solution is contraindicated in case of pump problem. not to the circuit problems. Here, if you are using sodium chloride, that will retain the water also. So there will be a volume maintenance will be there in case of hypo. Just again, I am just stressing the point. Sodium containing solution is very much useful in case of hypovolemic shock, the two circulatory failure. And then another one more contradict. Here is a contradict. Sodium containing fluid is to be avoided in case of any congestive heart failure. But congestive heart failure is not commonly seen in case of any sheep and goat. But nowadays we are also recording some cases with the distal edema and jowl edema and the jugular vein engorgement. Maybe some foreign body penetrating the heart is having leading to cardiac tamponade. That might be the reason for the congestive heart failure. Sometimes maybe endocarditis or some pericarditis due to some other reason also leading to congestive heart failure. So if you are having congestive heart failure in sheep and goat, don't go for sodium containing fluid. It is fueling on the fire again. Another one more thing, hypoproteinemic, hypoalbuminemic animal which is having low protein, especially albumin level is there. Sodium containing fluids to be avoided. Why? It is going to bind with the albumin. Again, it will reduces the oncotic pressure and it will exacerbate the subcutaneous edema of the sodium. Again, the albumin level will be reduced by the sodium containing fluids. The colloids, already we discussed the colloids, the plasma volume expanders. If you are giving colloids in the congestive heart failure, so again it is leading to death of the animal. So avoid in case of congestive heart failure. Only use in case of anemia with severe hypovolemic shock. And the renal function is not properly there, leading to oliguria is there. So that time if you are using colloids, it will lead to pulmonary edema and death. So renal failure cases you have to avoid, but renal failure cases are less in case of large animals. So